Hey guys, the next topic for this unit is going to be talking about membranes. Now membranes are a thin sheet of tissue, so the cells are going to be arranged into a tissue, and they have several functions, such as covering surfaces of the body, so lining the inside of the cavities like we talked about earlier. They serve as dividers, so they can separate different areas of the body. They cover surfaces. They help to anchor organs, keep them in place. And some of them even secrete lubricants, so that'll help organs move around and stuff like that. So they have a lot of important functions. We can have membranes that come from two different sources. We can have epithelial membranes and we can have connective tissue membranes. So let's go and talk a little bit more about those. The first ones we'll talk about are the epithelial membranes. Now, there's three types of epithelial membranes. There's the serous membranes, the mucous membranes, and the cutaneous membrane. Now, on these membranes, of course, the outer surface of the membrane is going to be made up of epithelial tissue, okay, epithelial cells. Now, what each one does, the function of each one is listed in the table here. So, a serous membrane, it will line the body cavities and it'll cover the internal organs that are in that space. The mucous membranes, they line the tubes and ducts that open up to the outside of the body. So your digestive system, your respiratory system, your reproductive system, those tubes are going to be lined with mucous membranes. And then finally, the last one is the cutaneous membrane, which we commonly refer to as the skin or the integumentary system, which is the next topic in this unit. Now, of the serous membranes, there's a couple more here. We've got the pleurae, the serous pericardium, and the peritoneum. These membranes are going to be the ones that line body cavities and cover the internal organs. Okay, they're not going to be connected to the outside of the body in any way. And within these membranes, they're going to secrete a fluid that'll act as a lubricant that'll help protect and condition the organs that are inside of it. Now, you're going to see two different words here: parietal layer and the visceral layer. The way these membranes are organized, they're folded. So you have an inside of the membrane and you have an outside. The parietal layer is the one you're going to find on the outside, okay? And the visceral layer is going to be what's on the inside. So if we look at the pleural or the pleurae membrane, that's going to be one that covers the thoracic cavity that we talked about in Unit 1. The parietal layer, the outside layer, is the one that's going to be covered the outside of the cavity. And the visceral layer, so the inside part of that membrane, that's going to be covering the lungs. Okay, so that's how those two words work: parietal layer and visceral layer. Parietal layer is on the outside, the visceral layer is on the inside. If we look at the serous pericardium, often you're always going to think of the cardiovascular system, so probably the heart. And in this case, the parietal layer of the serous pericardium will cover the pericardial sac, which is the membrane that covers the heart. And then the visceral layer is actually in contact with or covers the outside of the heart. And then we get the peritoneum. This layer is going to be lining the parietal layer is going to line the abdominal cavity, and then the visceral layer is going to be what encompasses the organs that are inside of it. So most of your organs in there are going to be your digestive system. So here's a look at how these fold up. I'm not terribly concerned that you guys know all of the detail in this picture at all. How I want you to remember it, though, is this side right here is going to be the parietal side. And this side in here, this part that's covering the fist, which would normally be the organ, is going to be that the visceral side of the membrane. Okay, so just to show you how those membranes are organized, there's an inside and an outside. The next type of epithelial layer is membrane are the mucous membranes, and these are the ones that are going to be lining the tubes and ducts that open to the outside of the body. So your mouth, your nose, your eyes, ears, anus, reproductive entrances. So that's where we're going to find mucous membranes, and they have different functions, but most of the cases they'll be trapping and removing foreign particles, so they form a really good form of protection against the outside environment. They'll also protect deeper tissues, and in some cases, for example, in the digestive system, they're modified so that they can absorb food and we can get nutrients from our food. Now, here comes the next set of membranes, and these are the ones that are going to be derived from connective tissue. Okay, so there's not going to be any epithelial tissue cells in this particular type of membrane. It's going to be all made up of connective tissue. And there's 4 different kinds. We've got synovial membranes, the meninges, the fascia, and then we have some membranes that surround organs that are made up of connective tissue. The synovial membranes, those are the ones that are going to be surrounding our joints. So the joints that we have between our bones, in our hands, our fingers, our elbows, our knees, those are all going to have synovial membranes lining the joint cavity. They will secrete a synovial fluid, and that synovial fluid will interact with the muscles and the tendons and the bone and the cartilage so that that joint moves freely and without any grinding or any serious contact. There will be some small sacs near a lot of the joints that help cushion so that we don't have serious impact between bone and bone, which can cause damage. And those little sacs are called bursae. And we'll have a closer look at those when we talk about the skeletal system. The meninges, they're a very special type of membrane, and these cover just the central nervous system, the brain and the spinal cord. The next membrane is the fascia, and the fascia is we can have superficial fascia, and we find that that's just underneath the skin, and that's going to help insulate our body. And then we can also have deep fascia, and that's going to cover, and it's going to separate. So if you get 2 muscles that are close together, this membrane will be what separates 2 different types of muscles. So they'll cover the muscles, and they help protect the skeletal muscles. And then finally, we get these collection of membranes that will surround the organs. So we can have a fibrous pericardium, that's going to surround the heart. We have a membrane called periosteum, and that surrounds bone. And we have another one that's called perichondrium, which surrounds cartilage. So when you see the words, or the root of the words oste or osteum, osteo, that's going to refer to bone all the time, and chondro or conj is always going to be cartilage. Okay, so just keep those in mind. It might make you easier to recognize some terms. All right, we have a quick blurb about some of the things that can go wrong. We said that in some of these tissues we can have stem cells that divide quite quickly, and a lot of times cells that divide quickly are linked to a disease that we all probably are aware of, which is cancer. We can get cancer in cells. We can also get cancer in tissues and organs. So it's kind of a little bit appropriate to talk to it right now. So it can occur in all tissues, but it's more frequently occurs in tissues that repair faster. So places like epithelial and connective tissue, which are damaged quite often, they heal quite quick. Cells divide really fast. So we find cancer in these tissues quite commonly. Cancer occurs as growths, we call tumors, and we get 2 main forms of tumors. We can have benign tumors, which I guess it would be the good ones in terms of prognosis. These are confined to a certain area. So the tumor grows in a certain area, and it can often be removed by surgery. Not relatively easy, but in some cases. And then we can have malignant tumors. Now, malignant are kind of the ones that are a bit more bad news for us. These are tumors that can spread to other parts of the body. The signs of cancer, what we look for when we're trying to diagnose cancer are pretty common. So you can see a lot of things that can be confused with other diseases or conditions. So some signs of cancer will include lumps. So an unusual lump will form in the body. We can have weight loss. There can be pain. If you're talking about the skin, there can be changes in the color or the shape of a mole. In the throat, you can have chronic hoarseness, where your voice is always raspy. You can have unusual bleeding. So the symptoms of cancer go, they're quite long, and they're quite different depending on where the cancer is and what type of cancer it is. Since these signs are all over the place. There's so many different ones. They're so not specific. It could be very difficult for a doctor to diagnose cancer. Over the years, we've developed a lot of different techniques for helping the diagnosis. So we can use stuff as microscopic studies. So we can use histology to study cells and tissues and identify tumor cells that way. We can use radiography. We can use ultrasound. We can use CT scans. We can use MRI. Or even positron emission tomography, so PET scans. And then we also look for stuff in the lab too. So we can take a blood test and look for certain things like PSA, for example, for prostate cancer, CA-125, CEA, CD. So these things are commonly looked for in blood tests, and that's an early warning sign, or could be an early warning sign of cancer if the levels of these different markers are elevated or lower, or however the case may be. Now, there's three known traditional methods for treating cancer. We can have surgery, which is the removal of the tumor. So we just cut it out. And this is less effective in malignant tumors, of course, which have spread all over the body. It's a lot harder to cut them out. We can have chemotherapy, which uses drugs. We use drugs that target cells that divide quite quickly. So oftentimes if you see somebody who's taken chemotherapy, they lose their hair because some of the cells that divide really quickly are the hair follicles that produce hair. So hair falls out because we're damaging those cells. They'll also be quite sick, ill, throwing up, vomiting, and that's because the cells that line our stomach, the epithelial cells, they're very fast dividing as well, so we're damaging those cells as well, which will make them sick. So those are two common side effects from chemotherapy. And we can also do radiation therapy. So that's where we use radiation to try and destroy those rapidly dividing cells, and we try and target it specifically so that we don't damage any of the cells that are surrounding it. There are new treatments coming along, stuff like immunotherapy, so where we train our immune system to look for specific cells, cancer cells, and our immune system will hopefully take care of the cancer for us. We can also use hormone receptor therapy. So there are encouraging new techniques when it comes to treating cancer. And a lot of times we use more than one of these types of treatment in order to help the patient and have a better prognosis, or help the patient become healthier faster.